Hi, my name is Tyler Kellenberger, and today our consulting team is going to tackle a complex and troubling healthcare ethics case that occurred recently at a well-renowned medical center in the United States.
The patient was a man named Daryl Young. He was 61 years old. He had heart transplant surgery on September 21st, 2018 in Newark Beth Israel Medical Center. He never woke up and he fell into a vegetative state. His family members were never notified that Young was in an irreversible vegetative state, and staff never offered hospice, palliative care services, or a do not resuscitate directive. Some background on what is a vegetative state. There are clear distinctions between people in a vegetative state and people who are in a coma or brain dead. People in a vegetative state may groan, move, or open their eyes. They are unconscious. However, a vegetative patient may perform involuntary muscle movements. They may also react to loud sounds and react to pain. So ultimately, a vegetative patient is more responsive than a comatose patient.
In 2007, the U.S. Center for Medicare and Medicaid Services set quality standards for hospitals to follow after a series of high-profile mishaps, including a teenage girl receiving a heart transplant and lung of the wrong blood type. Under the new rules, the number 85% has become a magic number in regards to transplant units around the United States. The federal government has to rely on the survival rate to evaluate the transplant units. This often gives hospitals a financial incentive to keep their program alive. If the survival rate falls below the expected rate, however, which is calculated by a CMS algorithm, then the agency can launch an audit. If this audit were to uncover serious problems, CMS could pull a program's Medicare certification and insurance companies would stop reimbursing the hospital for the transplants. This can be devastating to a hospital considering they charge $1.4 million for a heart transplant, reported by Milliman, a consulting firm, in 2017. In the past 10 years, more than 20 transplant programs across the United States have lost their Medicare funding after CMS found deficiencies. Another 40 programs enrolled in a systems improvement agreement with CMS, allowing them to continue receiving federal funding if they get back into the requirements of the program. Many notable hospitals have had to enroll in this agreement, including Johns Hopkins Liver Transplant Unit in 2008, and some other units like Baylor St. Luke's Medical Center Heart Transplant Unit have shut down entirely following the investigation. Losing a transplant unit can be detrimental to a hospital. Because of this, transplant centers have been known to turn down patients who are considered too sick or who have already rejected an organ that was deemed imperfect. Hospitals are depriving patients the chance of a life-saving surgery and are potentially wasting usable organs when the demand outranks the supply. Newark Beth Israel Hospital prides themselves on being the best heart transplant hospital that patients can trust, but in 2018, their performance rapidly declined. Out of the 38 patients that had a heart transplant, 6 of them died, and if Young were to be the 7th, their survival rate would slip even further below the national average, thus garnering the federal government's attention. A hospital should not further along their own agenda at the sake of their patients, and the story of Daryl Young will show just how morally wrong the doctors actually were.
Now we'll go into the recommendations section of the presentation. So basically what we'd be recommending would be 2 formal audits down 2 different avenues. So first, to investigate why the program was producing worse outcomes. Looking into the regulatory processes, standard operating procedures, any sorts of policies that the hospital had in place, and then investigating whether or not they were actually enacted, and if they were, why they weren't effective at that time. And then looking at an audit of the actions taken by staff throughout the patient's stay, looking at identifying what echelons of the care team knowingly or unknowingly partook in keeping him alive under those pretenses and their motives. And then corrective and investigative actions should be implemented and monitored by a third party. This adds transparency and legitimacy to the corrective actions that they're trying to take and any sort of remedial policies that get in place, and having a third party enact and monitor. And then to continue with the recommendations, of course it'd be important to involve the family with the investigation and kind of keep them up to date with any sort of investigations that are happening, the corrective actions that are being planned and how they're going to be enacted. Also, of course, involving JACO and ACA at the appropriate levels as required, speaking with them and determining whether or not this would be seen as some sort of sentinel event that would need further investigation on JACO's behalf or not, and just having them monitor the investigation themselves. And then, of course, on the admin side of things, getting ahead of press releases, publishing results and corrective actions, just not really hiding any of the results of the investigation from anyone in order to be as transparent as possible.
Moving on to ideas for improvement, key management decisions should be made in regards to firing, quality improvement plans, and potentially legal action. All of these management decisions should be based on data and information from the audits. Additionally, a system of accountability should be integrated into multiple levels of leadership. And most importantly, Newark Beth Israel should request for a Systems Improvement Agreement, SIA, with the Centers for Medicare and Medicaid. So what exactly is an SIA? Well, a Systems Improvement Agreement, SIA, is a legal agreement between a healthcare organization and the Centers for Medicare and Medicaid Services. The purpose of the SIA is to aid compliance with the conditions of participation, COPs, in federal programs. Newark Beth Israel Medical Center can request to enter into an SIA with CMS because they will likely be facing termination due to immediate jeopardy findings. The CMS defines immediate jeopardy findings as a situation in which a recipient of care has suffered or is likely to suffer serious injury, harm, impairment, or death as a result of a provider's, supplier's, or laboratory's noncompliance with one or more health and safety requirements. The SIA agreement between Newark Beth Israel Medical Center and CMS would force Newark Beth Israel's heart transplant program to participate in a series of improvement steps to address multiple faults in compliance with the conditions of participation, with the assistance of a consulting agency which was approved by the CMS. The SIA agreement would give Newark Beth Israel time to make improvements in complex quality, cultural, policy, and procedural deficiencies, up to 24 months. An SIA has various components, including an organization-wide assessment, a gap analysis, a corrective plan, and implementation. As such, it would give CMS a way to ensure large-scale improvement at Newark Beth Israel without completely removing funding. This would give Newark Beth Israel the time and support they need to address the concerns, design better systems, and train their staff to comply with the CMS conditions of participation, as well as general ethical standards. Ultimately, this would be the best option for the CMS, Newark Beth Israel Medical Center, and the community at large. This case shows the ever-present need for ethics guidelines and regulations in healthcare. It is a prime example of abuse of leadership power. It shows the dangers of factors such as groupthink, conformity, and social influence, which can cause a majority of an organization to participate in unethical and unacceptable behavior. Ultimately, this case brings to light the importance of transparency in healthcare and the need for national, state, and local health policies for ensuring this transparency.